Welcome everyone. This is our second webinar in our webinar series around COVID-19, working from home, employer obligations and considerations. We're going to be doing more of the webinars around specific topics on COVID-19 because that's what our clients and peers seem to be looking for right now. But our webinar series will, after this is all said and done, our webinar series will continue into topics that our expert team could speak to. So we look forward to having a continued allegiance with everyone on the call. And your hosts, that's me. Sorry for the picture. I'm Darcy. I'm the CEO and Chief HR Consultant of HR Primes. Joining me today will be Tar Heel. And I say joining me today, he's not actually intentionally going to speak, but there's a possibility, the working from home thing, that you might hear Tar Heel in the background, so I apologize. That said, he does have a lot to offer. He is in fact a certified human resource dog, as you can see by his credentials. So if he has anything to add, I'm sure it'll be well worth it. The content, legal disclaimer, the content does not, it's not legal advice per se. I do want to thank everyone for attending today. I know your time is busy, so what we would like to do, and we will email you with the code after, is provide everyone with a store credit of $75 to purchase any of the products that we offer, our online training modules. We have subscriptions, HR on call support, health and safety audits, et cetera, et cetera. So it gives you a great chance to check out our new platform and get any HR support that you need for a little bit less of the price. So our webinar outline today, you'll see there, submit your questions for the live Q&A at the end. This webinar is being recorded, so it will be on demand on our website, likely by tomorrow or the day after, and that will include all the Q&A sessions. So if there's anything you miss, by all means, hop on our website. It'll be there for you. We had quite a few people submit questions before the webinar started, so I have a list of those, but you have the opportunity to ask questions on the Q&A pane throughout. I believe I enabled it so people can answer the questions as well. So a whole bunch of people from my team are on the call today, and they might be answering the questions for you as the Q&A goes on, which we'll read for the benefit of all at the end. So to get started, we're going to be discussing 5 things today, 5 topics, and we'll try to make it brief in so much as we can get to the Q&A, because that's what most people are saying they really want to be involved in. Managing the performance of your employees, health and safety considerations for people working at home, alcohol abuse, and we kept it to alcohol abuse and not overall drug abuse because the statistics on drug abuse are not readily available just because, 1, some of them are illegal, so it's hard to pull that fine, and 2, the ones that are legal, it's hard to differentiate between what is, legal and illegal for the point of the statistics. Domestic violence, which unfortunately has become a significant issue. And finally, how to sustain employee engagement. So we'll try to finish on a high note for everyone involved today. So managing employee performance, it's not a secret formula. And what I mean by that is managing the performance of your employees is really not that different from people working at home that they are working in the office. The only difference is you can't see the whites of their eyes, which for some employers is the problem. So this is, a good reminder for those employers who find that a difficult scenario. First thing, and you're going to get used to hearing this, is communication is key. So it's really important to listen to your employee and their needs. This is new territory for most people. So the only way you can learn is to listen what the people who are experiencing are actually going through, make the amendments, make the changes, learn from your employees, and that will make it a better remote working relationship for everybody. Managers need to be realistic about their expectations. So this is something I've had noticed with a few of my clients who are a little bit upset about what they're getting back or not getting back from their employees. And a lot of times it really is an issue of what the manager's expectations are. If you have a stat problem, if you have a problem that needs to be settled right away, where you could simply just walk down to someone's office and say, listen, look at these numbers, they don't work. That is not necessarily going to be a realistic expectation in today's world. So it's important that your expectations are realistic so you won't unnecessarily be let down or put your employees in a not impossible to win scenario. Company policies should not only be reviewed, they should be updated, reinforced, and require greater reliance. It's important for people to know, and this is a driving point behind this whole presentation, company policies are for the workplace. As per the Occupational Health and Safety Act, the employee's home is now their workplace. the ability to enforce your policies, although a little bit more gray and easier to see and touch, still is the right of the employer and management. So it's important that you review them in such a way that it is in realization with the challenges that people are facing. In other words, realistic expectations. Trust is more important than ever before. So a lot of people are saying, well, how do we judge productivity? At the end of the day, again, you can't see the whites in their eyes, so you can't physically see them typing or putting that gadget on that machine. At the end of the day, the focus should be on results and output. If it takes somebody 6 hours to do what you're paying them 8 hours to do, but the results and output are there, then that should be sufficient in these days and times. And this will be something that endures beyond the COVID-19. So it's a good opportunity to kind of change your ways if seeing the whites of their eye is important to you. Use technology to engage. So examples of technology are video conferencing, dashboards, webinars like we're doing today. I think all of us, to one extent or another, would love to be in front of our clients or working with our peers. It's something that human beings require. But short of that, being able to jump on a webinar or a video conference call, what have you, it's a great way to see where your employees are at, what they need, what's getting done, what they need help with, et cetera, et cetera. So the technology is out there. It's important to use it now more so than ever. And feedback, evaluate, and improve. Again, any process, anything that's gauged, any performance management system, regardless of whether you're working from home, feedback, evaluate, improve is a staple of said process. So again, more important now than ever. Health and safety at home. So you heard me mention in the last slide that for the purposes of the Occupational Health and Safety Act, people's homes are now their workplaces. So you can see the definition of a workplace: any land, premises, location, or thing upon and or near where a worker works. So that's important to keep in mind. Your responsibilities as an employer remain the same, even though you're not physically on the same site as your workers. So your responsibilities start with your health and safety policies. All the responsibilities, the responsibility to provide the most reasonable care and safety as possible. Your policy should be revised, they should be reviewed, they should be reasonably filled with reasonable expectations, et cetera, and they're still required to be followed, and they are still required to be enforced. A lot of companies are having a problem with the enforcement mechanism, but that's something we'll talk about as we go through the webinar. A safe workplace. So the employer still has an obligation to ensure that workplace is safe and free from hazards. This seems odd for a lot of the clients that I've been talking to. I've been encouraging them to send out emails to their employees to remind them of their obligation, virtual inspections, things of that nature that would make it possible for you to take a look into someone's home without violating their privacy or eliminating that as much as possible, and still fulfill your obligation under the Act. Again, inspections. So these are the ways that you ensure safe workplaces. Agree to virtual inspections with your employees or provide inspection sheets with potential home hazards already populated. So we are going to have one that we've developed one. We're going to make that available to everybody that was on this call today, as well as all other HR Prime clients. But basically the checklist is something along the lines of, are you using an extension cord? Is the extension cord long enough? Does it have a cover over it to avoid a tripping hazard? Things that you wouldn't think about necessarily if you were working in an office or in a plant. These are things that you have to think about when you're working at home. So make it easy for your employees and populate the criteria for what would be on the inspection checklist, so they have an idea of what to look for and what they know is safe. Home hazards. So examples of home hazards: appropriate workspace. Ergonomics is a huge one right now. I have a lot of clients that I do this for. I'm reaching out to their employees and I'm getting a lot of virtual ergonomic assessments that I'm doing right now. Proper lighting is a big one. Mental health and addiction, kind of all in one umbrella. We're going to dive into that a little bit later in the module, but that is really important right now. This is not easy for anybody, let alone people that, in addition to isolating, have to work from home as well. And then the Ministry of Labor expectations. The expectation of due diligence and reasonableness exists. Again, the reasonableness thing is kind of interesting, because what might be expected of you when you can see somebody and they're 2 feet away from you might not be expected of you because they're at home and in their own working environment. On the other hand, because they're at home and they're not right next to you, some other types of expectations will be heightened. So it's important to remember that you have to perform your due diligence, but you have to do so in a mindset for what would be deemed reasonable in the circumstance. And one note, because I've had a lot of employees or employers ask me this question, the Ministry of Labor is not able, even though the workplace is considered where somebody works, they still cannot go into someone's home and perform investigations or inspections. So that's something to be aware of should one of your employees ask, or you're considering going down that road. So alcohol abuse and addiction, and I put in there in the subtitle, and I think my team pretty much agrees with this, seeing the stats, that employers can't afford to put their heads in the sand, because this is actually quite a big issue for employees, and they need to be aware of it. Stats indicate that employee mental health is a level typically only seen where people are experiencing serious disruptions or mental health issues. So it's clear that this pandemic is negatively affecting your employees' mental health, whether or not you're necessarily seeing it or not. So Morneau Chappelle, who is a trusted source of information for these types of things, they do what's called a mental health score, and this is a constant for them. So they do have a line for which they can gauge against, and they have tracked, in this is a stat that's right up until last month, they have tracked it to the point where they figure that the average employee working from home is in a serious state as it comes to, how their mental health is performing and how they are performing. And of course, whenever there's stressors, whether it be at work or at home working, employees are prone to turn to different things. So that might be petting my dog Tar Heel. That might be working out, which I know a lot of people aren't doing right now. So goes another stat. But a lot of people are turning to drinking. And it's unrealistic for anybody on this call to think that your employees at home are opening that first bottle of wine at 5 o'clock or later. It's just, from a due diligence perspective, you just can't think of that. Now, this is a US stat because Canada hasn't pulled a reliable stat on this yet, but it serves our purpose. In the US, it's deemed that 1/3 of employees are actually drinking on the job as it stands. So I put there very clearly that employees have an obligation to acknowledge these realities. That's part and parcel of your obligation under the Occupational Health and Safety Act. So in order to combat this, it's kind of a twofold mentality. Most companies now, especially with the legalization of marijuana, have drug and alcohol policies for their workplace. Again, those policies are enforceable at home, just as if you were with the bricks and mortars of your company. So it's important that you review your alcohol policy, do some retraining on your alcohol policy. And I know this last part is difficult, but certainly it's important to enforce your alcohol policy. It's difficult because typically when you see people on a Zoom meeting or a webinar or what have you, they're not holding that bottle of scotch in their hand. But peers being what they are, most of the time, when you look at addiction and alcohol issues, drugs, alcohol, et cetera, the number one way that gets reported to an employer, even outside of this COVID-19 thing, is through other employees informing the employer that somebody they believe has a problem or smells like alcohol, or et cetera, et cetera. So your employees need to be each other's best friends. And in turn, hopefully they do the right thing and come to you and you can assist and aid. And that's the second part of your obligation. Even though we are enforcing policies and that's a necessary thing, you still have a duty to accommodate under the Human Rights Code, even if workers are working from home. So it's good to be empathetic and realize that this is stressful times for everybody, that even though alcohol might not be the perfect vice to turn to when you're at home for 24 hours a day, it's possible that it could happen, and that those employees, if they were to reach out, need your help. And don't be shy away from the topic. Ask the questions, educate your employees on the dangers and the support options available to them. So, and that's really what's fulfilling your due diligence under the Act. Keep this in mind. I believe the majority of the people on this call are associated with health and safety, associated with human resources, or do it for a living. We're not mental health experts. We're not addiction experts. We have an obligation under the Health and Safety Act to identify these things and protect our employees from it. But there's so many great resources out there that are designed and exist solely for the purpose of making sure you, the employer, gets the education you need and the tools you need, and your employees get the assistance and support they need. So make sure your employees are aware of where, how, and when they can find these people. Okay, that's part of what you can do as an employer to combat this serious issue. More serious, and the reason I say it's more serious because obviously alcohol, give you a headache, and there's some other things that can come down this way. But I was tempted not to put this title in, but I think it serves the point that if you are one of those people out there that is a victim of domestic violence, could you imagine being told by your government and your employer that now you have to stay home every day? It's a difficult thing for people to get their head around, and we need to talk about it. So domestic violence is a reality for a lot of people, and employers must treat violence like a workplace hazard, because it is. If you consider that most companies in Canada have workplace violence and harassment policies, in Ontario, it is a requirement. One of the things that is covered under your workplace violence and harassment policy is domestic violence. So then the requirement to have a plan and be aware of domestic violence in the workplace, and again, keep it in mind, people's homes are now the workplace, the requirement already exists. So not to act on your requirement is in essence violating your obligations under the Act. And it's an interesting stat that one out of every 3 cases of domestic violence at home. Oh, sorry, begging your pardon. There's my first and hopefully only webinar screw up. 1 out of every 3 cases that are victim-related crimes called into the police are about domestic violence. To give you an idea about the crisis that this country and America is facing, and as far as this pandemic, domestic violence is a pandemic onto itself in a lot of ways, without the disease part of it. The tip of the iceberg: in normal times, these victims are often scared to be calling into the police as it is. One stat from McLean suggested that 80% of cases that are considered to be domestic violence in the home, either towards a spouse or a child, go unreported. And right now, this is the worst possible time for us to be thinking about all these stats, because we're in a pressure cooker. People are in isolation. They've lost their income. There's anxiety and fear. There's an increase in use of drugs and alcohol. So this is not the ideal time for us to be talking about this. We should be talking about this all the time before this ever becomes an issue. But right now, it should be a real concern for employers. The police associations, in coordination with Stats Canada, have already came out and said that they have seen a 20 to 30% increase in domestic violence since the mandated lockdown has occurred. That's something to think about. 20 to 30%. That's a pretty significant feature. And the last thing, and I find this to be a truly horrifying stat, just because of the language that was used in the survey, that 1 in every 10 women are currently very or extremely worried. The stat was actually quite much higher when it came to 1 in 10 women who are concerned about the exposure to domestic violence. This was a particular question in that survey that said 1 in every 10 women are very or extremely worried, which means you should be extremely and very worried about your employees, because we cannot be so naive to think that if 1 of every 10 women out there are at that state, that 1 of them may not be your employee. So you need to be treating workplace domestic violence like an actual hazard. So how can we do that? So here's a couple of opportunities to be aware. So first off, and again, I said get used to hearing this, communication is key. Set regular check-ins with your employees, provide training and education, make sure that they get all those support numbers and resources that they need. It's absolutely critical for people that are able and can reach out to be able to reach out. So provide opportunity. Now, this is one that I've kind of been preaching to my clients, because I've had a lot of clients ask, what are we supposed to do? The thing is that just in this happens whether you're in the workplace or not. It's more difficult for employees who would want to reach out or who would want to ask for help to do so when they're at home all the time with the person that might be the perpetrator of the violence. So provide opportunity. Tell them, require meetings at home. Ask for those meetings to be private. Make these meetings and these screen time things social welfare checks, if you will, which is a great saying that I heard from somebody yesterday. But, the reason I tell people to put it in writing is because there's a lot, it makes sense that when you have a partner that is violent, that they also become paranoid. And it would seem a little bit odd when, your spouse says to you, I have a meeting and they've asked for us to do it in private for whatever reason or the other, to be able to show them the email that says, yes, this is the requirement that my employer's put on me. I'm getting paid. I need a little bit of privacy. That's providing that person an opportunity that if they can, or they should be able to, or if they're able to potentially ask for help. and look for signs. It is the obligation. So when you're doing these inspections and things of that nature, look for signs of abuse. So signs of abuse, and I know this isn't the easiest thing in the world, but signs of abuse are bruises. I know that sounds, really blunt and common sense, but it's there. A broken table, things like that. These are all different things that when you're doing a virtual inspection or you're doing screen time, if someone did want to reach out for help and wasn't actually able to say the words, these are things that you might find in the background for someone that was looking for signs of domestic abuse to pick up on. So keep an eye on communication. So be mindful of the communication that you're getting from these employees. If the communication starts to change or you start to get some type of vague messaging in it, that's something to keep an eye on, and use your colleagues as a resource. So make sure there is a good peer network that if someone was in a bad situation and had the ability or the comfort to talk to a coworker, that might be able to get back to you and you could provide the support they need. So finally, how to sustain employee engagement. So we've talked about a lot of obligations, some of which are on the darker side of what employers should have to deal with on a day-to-day basis. So let's talk about how to sustain employee engagement to finish off the webinar before we hit the Q&A. Recognition for performance. That's always great. It doesn't matter whether you're in the workplace or not, but right now it's even more important because you just can't walk up to somebody, put your hand on their back and say, good job. So what you can do incentives, and be mindful of the incentives. Make it an online gift card. They're at home anyways, give them an opportunity to, get away from work, but be recognized by work at the same time. And as one of our more senior consultants on our team said, and his wisdom shows through, sometimes a simple thank you is enough to be a motivator for everybody. Team building activities and tools to help coworkers connect. Now, not only does this help sustain employee engagement, it also helps out with the health and safety obligations that we've been talking about, okay? So move business lunches to virtual lunches. Like I literally had, this is an idea I took from a client where they literally did what they used to have lunches every second Monday with their management team. So they had lunch ordered to each one of the management people to their house, and they actually shared screen time and had their business lunch virtually. And the employer paid for that, and it's a great gesture, but certainly having a virtual lunch or a business lunch, meetings and projects, funny hat contests. I had another client do, send them pics of your pets to keep people happy and encourage. Anything that keeps your team talking, the only limit is your imagination. So, think about the different ways you can reach out to your team and connect and have them reach out to one another. Mental health management is a great way to fulfill your health and safety obligations and also sustain engagement. So company chats, lunchroom chats, LinkedIn has some great chat rooms and all that type of different things. Virtual walks. This is something that I actually thought of, toot my own horn, I actually thought of for one of my clients because I know other companies might be doing this, but a lot of people during lunch hours have groups that go on walks on nice days. So I actually encouraged a group that did that, one of my clients, to actually say, take your phone with you. Take your phone with you and put it on, on a chat or something together and share the virtual walk. Talk about the things you're seeing. Talk about the nice day, things like that. Even had one of our consultants suggest remote I think I said mediation. That's supposed to say meditation. So remote meditation or access to healthcare providers and people that can cope with mental illness is always a great tool. A little bit more costly, but it's well worth it because they're employees after all. And again, for the last time, communication is key. So updates, consistent information, use of LinkedIn and similar apps to continually flow chatter, processes like onboarding and training, move those to be made interactive or online, and then one-on-one conversations work. So there's a stat that I have about it that I'm a big fan of. But you can see here why engagement is so important. That 83% of Canadians are satisfied with their job, and that's because 90% are engaged. So this is something that even though our employees are working from home, it's critical and key to business operations as well as the mental health of both you and your employees to continue to engage your employees. And again, the stat on the 101, there was a recent, and I forget the name of the company, begging your pardon, but reported that 44% of workers are more likely to be engaged because their manager or their supervisor or their owner reached out to have a one-on-one chat relative to just, the get everyone on a staff meeting or give everybody on a Zoom meeting. That one-on-one contact, that personal contact means a lot to employees. And for your employees, it'll certainly increase engagement. So we're at the end. We're just about to go into our questions and answers period. Hopefully so far you've enjoyed the content. It was our pleasure to be able to do this for you. A little bit of shameless self-promotion. You'll see 2 of our key products that we offer. And again, you'll be getting a $75 credit. So a lot of the questions that we covered in this webinar are questions that we literally, experiences that we literally have with our clients. So our flagship program is our on-call support. It's unlimited calling and emailing. You can call as many times as you want. You can email as many times as you want. That is the entire price for the year. You can call 500 times. It's still only going to cost you $899 for the year. You get free custom documents and a whole bunch of other stuff with it as well. By all means, take a look on our website. And then our one-click compliance. You got to check it out. I can't do it justice. Go to our website, click on the button. It is a brand new platform. It's better than anything that's out there. Don't take my word for it. Just check it out. And again, the $75 credit is free to use. Our team, Sheila, she's our HR consultant in BC. She just joined us. I'm not sure she was able to make the call today. Morris and Steve are 2 of our very senior, I mean, I don't mean by age, well, maybe, but they're 2 of our most senior HR consultants, and they drive a lot of respect with our client base and with the team, of course. Chris and Dan are our 2 awesome health and safety consultants. So we're really happy to have them on board. Neil, our director of business development, he's been with me for a long time and provides a lot of leadership to our team. Benjamin, who is our most awesome senior HR researcher and content developer. A lot of what you're going to see coming on our website in the months to come are going to be coming from both Tanisha and Taylor. There she is. They're great writers. They're great developers of content. So keep an eye out for their stuff. Of course, you've seen me. And last thing, here's our information to get in touch with us. And I would be remiss not to include Tar Heel. Yeah, there you go. I'd be remiss not to include Tar Heel in the presentation. So he's my, in lieu of alcohol sometimes, he's my de-stressor, if you will. So this is a great time for Q&A. I don't see any questions in the Q&A panel. If anybody has questions, you're more than welcome to stick your mic on and we can answer them in real time. And I have questions that were submitted to me in advance, so I'm happy to run through those. But if anyone has any questions now, by all means, put your hand up or just speak out loud and we'll do our best to answer them for you. Okay, so here's a question that just came in. Domestic violence. If an EAP is not part of your offerings, regional health units have increased the remote accessibility to counseling. So that was not a question, that was an FYI. So that was actually an ad from Dan, who's one of our health and safety guys. Great ad. It is something to keep in mind. I have actually reached out to a couple of I have a couple of clients who have reached out to me who don't have benefit programs or don't have EAP programs. EAP programs are available to companies as a one-off. So that's something that and they're very cost effective. So if it's something you're looking at for your employer or your employees, call your benefit company. See, it's dollars, it's cents on the dollar per day. So call your benefit company or reach out to a benefit company or broker, or even give us a call. And we have lots of benefit brokers that we work with that we'd be happy to put you in touch with, who would make sure that you are taken care of. So again, anybody who has a question, just pop it up on the panel or just ask out loud. I'm going to read a few of the questions that were submitted to me in advance of all this and answer them for you. This is actually a question that wasn't necessarily about this webinar, but they asked it, and the person's on the call, so I want to be able to provide them with the answer. We call back employees from layoff and they're refusing to come back. They are not sick or looking after kids. Do employees have to come back to work? The answer to that is yes, they do have to come back to work. If they meet any of the criteria of the CERP, so if they're at home with symptoms, it doesn't have to be of the virus. If they're at homes with symptoms, which could be the virus, if they're looking after somebody, if they need to provide daycare because no other daycare is provided, those are things that if they get called back from a layoff, you would allow them to stay at home. you switch their ROE to be placed on a medical leave, and they would continue on. And keep this in mind, that medical leave is now protected. So if someone comes back and they have none of those symptoms or are not under those criteria, they're required to come back to work. And yes, you can take it upon yourself. Unfortunately, I've had to do a few of these this week. It would be considered that they voluntarily resigned. So you would change their ROE accordingly. They're likely still going to get their cert from the government, but the government will likely go back and claw it back afterwards. So it's important that you educate your employees on that before you make that snap reaction just to get rid of them. Another question, what do employers need to consider when implementing mandatory work from home arrangements? So that's a good question. One of the things that I've been pushing my employers to do, and I've done it up for a couple of my clients, is coming up with a written policy on remote work if you don't already have one. I've even been going so far as to putting contractual terms in place. They're ad hoc contractual terms. Because of the circumstances, it wouldn't be considered a change in employment, provided you're not taking anything away from the employee. What you're basically trying to cover is things like acceptable and unacceptable use of remote access, internet access, the protection of confidential or private information. And then of course, with anything, there would be something along the lines of consequences for non-compliance. So again, that's a little bit of a health and safety piece. To bring in a little bit of a health and safety piece, the things that we talked about today in this webinar, you can certainly include in your working from home policy or contract if you felt so inclined. We had a couple more questions. Is there obligation? This is actually a good question. I never even thought about this. Is there an obligation around working alone at play? So as many of you know, especially the health and safety people on the call, there are obligations around working from home and taking appropriate protections and precautions for people who do work from home. In this case, things like alcohol addiction and domestic violence, yep, that's, you could say that's where your obligations around working from home come into play. The obligation to work from home the obligation to protect a worker who's working alone mostly centers around potential hazards that are associated with that, which are not typically going to be existent here. So for example, if you're a employee working as a gas attendant, one of the things that would be a hazard as far as working alone would be the handling of cash, the access to get help if help was so needed. Those types of things aren't necessarily in play here, but certainly as it pertains to mental health, as it pertains to addiction, as it pertains to reaching out to your employees on a regular basis, those are things that can quell your obligation, even though the obligation isn't the same as if, like I said, they were a gas attendant handling cash, having to close up late at night, et cetera, et cetera. How does the legality, really good question this time. How does the legality of the substance of the employee is addicted to impact the employer's obligations when they're working from home? It's a good question, but it's a really simple answer. It's the same as if they're in the workplace. So the fact that alcohol is legal or weed is legal doesn't mean that they're able to do so at the workplace, on the workplace. The workplace is home. If you want to have a no alcohol or no drug policy from 9 to 5, which is your working hours, then you have the ability to enforce that even if they're at home. So the legality of the drug, whether it be a legal drug, a prescription drug, or whether it be an illegal drug or high content alcohol, has no bearing on your ability to enforce your drug and alcohol policy. What's another question we got here? Issues employers must consider when discussing an employee's addiction problem with the employee. Okay, so sorry, I think I mumbled there because I was trying to read it. What are some of the issues employers must consider when discussing an employee's addiction problem with the employee? So this is a really interesting one, and it kind of goes back to, it's more of a human rights issue than it is a health and safety issue. So basically, an employee does not have an obligation to disclose a disability. So how you come about it is kind of important. There's nothing wrong with reaching out to your employees and educating them, asking anybody who has help or has symptoms to reach out or give a number where they can reach out to. There's nothing wrong with absolutely doing everything, asking about symptoms and things of that nature. You just can't come right out and ask for a diagnosis. You just can't come right out and ask or even accuse, we believe you have a drinking problem, unless you have some sort of good cause. So if you're on a Zoom call and you see somebody who's literally has an open bottle of wine with them in a wine glass in their hand, you can breach the subject. You're not going to accuse them of being an alcoholic, but you're certainly going to call them out on basis of your drug and alcohol policy. But at that point, you can also offer help. And typically with working from home arrangements, because I have had some experience with this before the COVID-19, typically the offer of help combined with the threat of enforcement of a policy is a perfect storm for someone to actually fess up and say, listen, yeah, I could use some help. I've been drinking a little bit too much lately. So, but be careful about the conversation. Accusations can't be made. A specific question can't be asked. Your human rights obligation has not changed just because someone's working from home. Probable cause still has to be had, and the privacy of the employee still needs to be respected. And we only have 2 more questions. And then I'll see if anyone else has any questions, and then we'll call it a day. And again, keep in mind, if you have questions that follow this webinar, don't hesitate. Everybody that's on this webinar, because there's a few people that were on the last webinar who received the free 30-day trial for on-call. Everybody that's on this webinar, we're going to extend the same thing to you, just so we make sure that all your questions get answered. So if you do have questions about anything and you didn't get a chance to answer them today, by all means, call or email us. The next 30 days is a free on-call trial. We'll make sure you get the answers you need and make sure everyone else gets the answers as well for the benefit of everyone on the call. Companies may have the right to restrict employees in coming to work. How can they reduce the risk of discrimination claims? So again, another good question. This is actually a question that I've had a couple of times now. I've kind of overlooked it when it's come to me prior, just because of the nature of it. But when you look at the question for its basis, it is a good question. It's wise to have a policy in place about your layoff protocol and your callback protocol. So the layoff and callback protocols can have something it can do with importance of the work relative to the employees, and that may be a determining factor for who you call back. Another factor might be seniority. One way or the other, it's wise to have something tangible for your process for laying off people, which should be tied, by the way, to the CERP requirements. So if you're going to send somebody home, you should have a process that's tied to the CERP requirements. If you have any of these requirements, we are going to send you home. That will avoid the chance of a discrimination claim. When you're calling somebody back, make sure that you have criteria for calling them back, which again, may avoid the potential for a potential human rights claim. And I only say this, and this is again, the darker side of HR. There are a lot of employers out there. I like to think that's a minority, but I know there's a lot that are using these opportunities as they see them to get rid of problem employees. So they're picking and choosing the employees that they think, are not the best employees in the lot, may have attendance issues, number of different things, but they're picking and choosing their employees to lay off based on the quality of the worker, in their opinion, not necessarily any tangible expectation or criteria. So it's happening. So because it's happening, it's wise to have a protocol to protect yourself. And last question I have, and then again, anybody who wants to jump in with something, you're more than welcome to do so. If an employer decides to send an employee home due to health concerns, should the employee be informed? If the employer decides to send an employee home due to health concerns, the employee should be informed of the reasons why. So, okay, so this is a question. Basically, they're asking, it goes on, it's a paragraph of a question, so I'm going to summarize it. They're wanting to know if other employees should be informed of the reasons why an employee is sent home for health concerns. This is, it's a good question to end on because it's not a perfectly answerable question. I suspect this question will be up there for debate for some time and likely be settled in a courtroom or in front of a privacy commissioner at some point in the future. There's the health and safety answer that says if someone in your workplace has been exposed to COVID-19 or has likely symptoms of COVID-19 and that you have sent them home, that you have a duty, a reasonable duty, inform other people that this person has been sent home because they had symptoms associated with it. So be on the lookout because that person's risk has now been enhanced because they've been exposed to someone who has symptoms synonymous with COVID-19. On the other hand, there's the privacy issue that employees have the right not to have personal and medical information shared. There's no right or wrong answer. Well, there is a right or wrong answer. We just don't know it yet. At the end of the day, I think what it's going to come down to is, and I've mentioned this a few times, and I'm sure Dan and Chris, our health and safety guys, could correct me if I'm wrong. But at the end of the day, I think it's what's reasonable in the circumstances. Me personally, I would be tempted to be careful about disclosing people's medical information. On the other hand, if it turned out that one or two people were decidedly, if I sent someone home because they had symptoms and then I found out at a later date that they did in fact have the COVID-19 and they've been in the workplace for some time and exposed to people in the immediate area, I'd be inclined to let those people know, just the people in the immediate area, with the expectation of privacy. Really good question. Difficult answer to answer right now, but that's my take on it. If Dan or Chris wanted to chime in, I'd certainly be interested, or actually any of the team from a health and safety or HR perspective, I'd be interested to hear your thoughts. But certainly, I know that's going to be a good discussion for our team after this call is over. I just did have a question submitted. Ergonomics is a concern for me. We have repeatedly offered to supply our employees with anything they need to work comfortably at home, but they said they didn't need anything. What happens if an employee then reports a back injury due to a bad chair? If they want time off, how do we handle that? It will be a WSIB claim and potential downside. And the answer to the last question, will it be a WSIB claim? Yes. WSIB is treating ergonomic or muscular, whatever that word is, diseases as WSIB for the meantime. There has been some rumor that they are going to temporarily amend that, but I don't see it happening. As far as what you can do, an employee, like, proper ergonomics is very much an individual thing. So if someone has a bad, like, there's still an argument amongst qualified ergo professionals that sitting in a 90-degree chair is still the best sitting posture for many people. And it's very people specific. So I'm cautious of dictating to somebody what they require as it comes to poor ergonomics or not. But in certain cases, I have one case, for example, where I have an employee who's working from home and we had an ergonomic chair fitted in the whole bit, brought in for them in their office. They didn't want to use that ergonomic chair at home and we insisted on it. So a case like that where we knew that this chair was the right thing for that person, we insist upon it, and the punishment would be under pain of violating your obligations under the Health and Safety Act. It's a disciplinary offense. Unfortunately, as it pertains to WSIB, it's a no-fault insurance. So even if the accident was by the fault of the employee for not doing their due diligence, WSIB's still going to pay, likely going to pay, I would say. So, Dan, is your mic on?
Yes, it is.
Okay, because I seen you raised a hand. So I was thinking that you might have something that you wanted to say.
Yeah, just a couple of points, and I'll start with the ergonomics one. You're right on with respect to WSIB and their position. And the employer, of course, has an obligation to ensure that hazards are dealt with within the workplace, and ergonomics is certainly one, as indicated earlier. There is I believe you have within your system a checklist on workplace ergonomics, basic workplace ergonomics, which I would highly encourage people to utilize. If you have any questions, if you can't find it, contact any one of us with an HR Prime. We'll make sure we'll pass that along to you so you can use that. That should be part of your overall approach to working at home, whether it's during this time or any other time. So definitely make use of that. And I also want to come back to the previous comment you made with respect to issues in sharing information on illness in the workplace. If it's a contagion such as this is, or any other contagion, you're absolutely right in that you have an obligation to share that information with those people who are most affected, with the promise by those people that this is held in confidence. And it's only being shared for the purposes of their own protection and not to be shared among others. So absolutely correct on both those points.
Awesome. Really appreciate the insight. And that's, again, little shameless self-promotion, but at the same time, a little bit of recognition for everybody, because we all work together to come up with the content for our webinars. Just because I'm the one speaking along with Tar Heel, of course, It's everybody that you see in the screen that gets together and makes this happen. The diversity of the team that Neil and I from the beginning kind of put together, it's important to us that when I could say to you that this is my opinion based on my 24 years of HR experience, but guess what? We have a guy like Dan Zeus, who's been doing this for longer than I have, who's been doing it in the health and safety circle, and Chris Goodall the same, that can actually answer these questions and make sure that you get all the right answers you need. So thanks for that, Dan. I really appreciate it. I think Steve put up his hand as well.
Well, you did. Thanks, Darcy. And Dan, love the bird in the background. It kind of sounds like a crow. I'm not sure if that's what it is or not. I would like to make a couple of comments about, just add to what Darcy had mentioned about both alcohol or substance abuse along with domestic violence. And I think it goes towards how you actually deal with those situations. And just a very fast tip from what I've seen over my several years of experience is that good leaders have a very good understanding of their employees. So you know how they perform at work, and you also know about their personality and their families and so on and so forth. So that when something isn't right with them, it's as though you have a baseline of what you know about them. And although sometimes there's bruises, I should say, and that's just a terrible thing, but oftentimes there's subtle cues of difference in their baseline personality or performance. And then that gives a rise for us to ask questions. And sometimes when you pose the question, hopefully in confidence, you might get an answer that will allow you to help them out. Oftentimes they don't. So what a lot of folks have found is very helpful is you've got to take it underground. So rather than have a conversation that may put them in harm's way, invite them to talk to you via email. And oftentimes they'll be much, much more open on email, and that then in turn gives you a chance to help them out.
Excellent. Thank you so much for that, Steve. And thank you all for participating. The people that asked the questions in advance, the people that asked the questions today on the webinar. I believe that's it. This webinar will be, it's been recorded, so it will go up on our website and it's on demand. So if there was part of it that you wanted to see again, or you wanted to refer it to a friend for them to benefit from the knowledge, that's terrific. We will be sending out a code, reaching out to you with an email with the code for the $75 credit. Please do check out our website. We spend a lot of time and we'll need the same money, but it's a lot of time and effort to put out something that's better than what's out there now. And integrity and quality is a cornerstone of HR Prime. So thank you everyone for coming. I keep on saying, thank you everyone for coming. And I wish you all to be safe and have a great week. Take care.